The 2019-20 coronavirus pandemic is an ongoing pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2. The outbreak was first identified in Wuhan, Hubei, China in December 2019, and was recognized as a pandemic by the World Health Organization, WHO on the 11th of March. Currently more than 664,000 cases of COVID-19 have been reported in over 190 countries and territories, resulting in approximately 30,800 deaths. More than 142,000 people have since recovered. The virus is mainly spread during close contact and by respiratory droplets produced when people cough or sneeze. Respiratory droplets may be produced during breathing, but the virus is not generally airborne. People may also catch COVID-19 by touching a contaminated surface and then their face. It is most contagious when people are symptomatic, although spread may be possible before symptoms appear. The time between exposure and symptom onset is typically around 5 days, but may range from 2 to 14 days. Common symptoms include fever, cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is no known vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy. Recommended preventive measures include hand washing, covering one's mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. While symptoms of COVID-19 can be relatively non-specific and infected people may be asymptomatic, the two most common symptoms are fever and dry cough. Less common symptoms include fatigue, respiratory sputum production, loss of smell, shortness of breath, muscle and joint pain, sore throat, headache or chills. Strategies for preventing transmission of the disease include maintaining overall good personal hygiene, washing hands, avoiding touching the eyes, nose or mouth with unwashed hands, and coughing or sneezing into a tissue and putting the tissue directly into a waste container. Those who may already have the infection have been advised to wear a surgical mask in public. Physical distancing measures are also recommended to prevent transmission. Many governments have restricted or advised against all non-essential travel to and from countries and areas affected by the outbreak. However, the virus has reached the stage of community spread in large parts of the world. This means that the virus is spreading within communities, and some community members don't know where or how they were infected. Hand washing is recommended to prevent the spread of the disease. The CDC recommends that people wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when hands are visibly dirty, before eating, and after blowing one's nose, coughing, or sneezing. The CDC further recommended using an alcohol-based hand sanitizer with at least 60% alcohol by volume when soap and water are not readily available. The WHO advises people to avoid touching the eyes, nose, or mouth with unwashed hands. Health organizations recommended that people cover their mouth and nose with a bent elbow or a tissue when coughing or sneezing, and disposing of any tissue immediately. Surgical masks are recommended for those who may be infected, as wearing a mask can limit the volume and travel distance of expiratory droplets dispersed when talking, sneezing, and coughing. The WHO has issued instructions on when and how to use masks. According to Stephen Griffin, a virologist at the University of Leeds, wearing a mask can reduce the propensity for people to touch their faces, which is a major source of infection without proper hand hygiene. Masks have also been recommended for use by those taking care of someone who may have the disease. The WHO has recommended the wearing of masks by healthy people only if they are at high risk, such as those who are caring for a person with COVID-19, although they also acknowledge that wearing masks may help people avoid touching their face. Social distancing, also known as physical distancing, includes infection control actions intended to slow the spread of disease by minimizing close contact between individuals. Methods include quarantines, travel restrictions, and the closing of schools, workplaces, stadiums, theaters, or shopping centers. Individuals may apply social distancing methods by staying at home, limiting travel, avoiding crowded areas, using no contact greetings, and physically distancing themselves from others. Many governments are now mandating or recommending social distancing in regions affected by the outbreak. In late March 2020, the WHO and other health bodies began to replace the use of the term social distancing with physical distancing to clarify that the aim is to reduce physical contact while maintaining social connections, either virtually or at a distance. The use of the term social distancing had led to implications that people should engage in complete social isolation, rather than encouraging them to stay in contact with others through alternative means.